So good morning. Good morning to all of you. We'll start. Okay, so welcome back to the MCQ and image-based revision part 2. Okay, we'll continue this series. I've started the series from yesterday and we will continue till the ini-cet exams. Okay, now some images and some MCQs again for you. Good morning to all of you once again. Have a look, starting with the first MCQ. I'm Dr. Pradeep Pawar, Professor of Anatomy. Okay, identify the blue marked structure. The blue marked structure. Yes, you can guess. The blue pointed structure or the blue marked structure. Any guesses? No, it's not corpus callosum. Agar corpus callosum hota, I would have marked it like this. I would have marked it like this. Had this been corpus callosum, right? So that is corpus callosum. Anyway, now that you have told me corpus callosum, what are the parts of the corpus callosum? Just a quick go through. What are the parts of corpus callosum? What is this for the corpus callosum? Here, one moment. Here, what is that? Rostrum. What is this? The bend of corpus callosum. Genu. This is the trunk or the body, and the posterior part is the splenium. So rostrum, genu, trunk and splenium, these are the parts of corpus callosum. What are the types of fibers? Corpus callosum is a white fiber. So what are the types of fibers the corpus callosum has? Yes, what are the types of fibers? These are the corpus callosum connects similar areas in the opposite hemispheres. Similar areas in the opposite hemispheres. What do you call this? As commissural fibers. Yes, very good. So these are commissural fibers. Corpus callosum is an example of commissural fiber. I'll come to the pointed structure later. We'll just finish this. Tell me, what is this sulcus above the corpus callosum? Above the corpus callosum, you can see the sulcus here. Name. Name. So whatever comes in my way, I'm telling you. What is the name of that sulcus above the corpus callosum? And this is what we call as the callosal sulcus. Callosal sulcus above the corpus callosum. And who lies in this callosal sulcus? If you can tell me. Callosal bache, callosal sulcus. Who lies in this callosal sulcus? Come on, come on, come on. Answer. Who lies in this callosal sulcus? There's an artery which lies, there's a vein which lies. You name it. You name it. Do not retract your messages. That's okay. Even if it is wrong, it's okay. Wait. Pointed structure is the. I'll tell you. What is an artery in the callosal sulcus? That's an anterior cerebral artery. And which is the vein here? The vein is anterior cerebral vein. So what lies in the callosal sulcus? The anterior cerebral artery, which is a terminal branch of internal carotid artery, and the anterior cerebral vein, which is a superficial vein of the brain. Superficial vein. Okay, so anterior cerebral artery and anterior cerebral vein. I'll come to the pointed structure after some time. Let us finish the rest of the things. Okay, what is this sulcus? If you can tell me, what is this sulcus? This one. What is this sulcus? Above the callosal sulcus, what is that sulcus known as? Yes, anyone? Sulcus above the cingulate, about the callosal sulcus. I told you the name. That's a cingulate sulcus. Okay, that's a cingulate sulcus. Yes, cingulate sulcus. And what is this lobule which it encloses? This is the paracentral lobule. Paracentral lobule. And which part of the body is represented here? The pelvis and the lower limbs. The pelvis and the lower limb are represented in the paracentral lobule. Paracentral lobule. Okay. So this is the callosal sulcus. This is the cingulate sulcus. Encloses a small area named the paracentral lobule. And what is represented here? The lower limbs, the pelvis and the perineum. Fine. What is this sulcus? Anyone? What is this sulcus? You can see a deep sulcus there. What is that sulcus known as? Come on, anyone? Easy है? हाँ, yes, urinary incontinence, right? That's no, ये है, this is the parietal lobe है ना, this is the parietal lobe and that's the occipital lobe, parietal lobe, occipital lobe. So this is the parieto-occipital sulcus, parieto-occipital sulcus, and you have a sulcus here. It's not very well drawn here, and this would be the calcarine sulcus. It's not drawn here well. That's a calcarine sulcus. So parieto-occipital sulcus, this is parieto-occipital, and that's the calcarine sulcus, calcarine. Okay, very good. Chalo, coming back to the MCQ now. What is a pointed structure? Now you tell me. What is a pointed structure? It is pointing. What is this? Before I tell you, what is this structure which I'm pointing now with the arrow? Chalo, answer this. What is this structure which I'm pointing with an arrow? Yes, come on. No, that's not third ventricle. That's a fornix. This is the fornix. And if I draw something here between the corpus callosum and the fornix, yes. What is this structure that I've drawn here? What is this structure which I've drawn here? Between the corpus callosum and the fornix. What is this small... Yes, what is this structure? Any guesses? Between the corpus callosum and the fornix, that's a septum pellucidum. Very good, that's a septum pellucidum. And now if I break the septum pellucidum, if we break the septum pellucidum and we go on the lateral side, we go laterally. If we break the septum pellucidum and we go laterally, we come into a very big cavity of the brain. And what is this big cavity here? That's the lateral ventricle. That's a lateral ventricle. So the blue pointer is pointing into the lateral ventricle. Okay, that's a lateral ventricle. Clear hai? All of you, are you following this? So this cavity is the cavity of the lateral ventricle. And who lies in the floor of the lateral ventricle? The roof of the lateral ventricle is formed by what? Corpus callosum, right? The roof of the lateral ventricle is formed by corpus callosum. And who lies in the floor of the lateral ventricle? One is this nucleus and second is this nucleus. Identify number 1. What I have written as number 1. Yes, if you can identify this, number 1. That is the nucleus which lies in the floor of the lateral ventricle. Any guesses? The one with a star, that nucleus. Caudate nucleus, very good. That's a caudate nucleus. And what is number 2? What is this number 2? Thalamus, very good. So the caudate nucleus and the thalamus, where do they lie? They lie in the floor of the lateral ventricle, right? And how are they placed? The caudate nucleus is lateral. The caudate nucleus is lateral and the thalamus is medial, right? Thalamus is medial, the caudate nucleus is lateral. So this becomes the floor of the lateral ventricle. The roof of the lateral ventricle is formed by the corpus callosum. Corpus callosum. Clear to all of you? Now you tell me, if that's the thalamus here, what is this cavity here? What is this cavity? If I draw a cavity here between the two thalami, what is the cavity there? Come on, answer this. Between the thalamus and this is the hypothalamus, right? The one below the thalamus is the hypothalamus. So what is this cavity between the thalamus and the hypothalamus? Yes, come on, answer. That's the third ventricle. Very good. So third ventricle is between the thalamus and hypothalamus of both the sides, of either sides. What is this section we have taken? We've taken a sagittal section. These are the two hemispheres like this. These are the two hemispheres and we have taken a sagittal section. When we take a sagittal section, we are actually cutting through the third ventricle. We are actually cutting through the third ventricle. So this area that I'm drawing now, this is nothing but the third ventricle. Clear? So we have actually cut through the third ventricle. Okay. Very nice. Now this lateral ventricle would communicate with the third ventricle through this opening. What is this opening here? If you can answer this. The lateral ventricle communicates with the third ventricle through a small opening there. Yes, name of the opening. Come on, my dear children. What is the name of the opening here? The communication between the lateral ventricle and the third ventricle. That's the foramen of Monro. Imagine nahi bache, it's foramen of Monro. That's the foramen of Monro through which the lateral ventricle communicates with the third ventricle. And this third ventricle would be communicating here. Look at this. This is a small channel. And what is this ventricle? That's the fourth ventricle. So how does the third ventricle communicate with the fourth ventricle? What is this passage? Yes. What is this passage? I've just marked that passage. That's the aqueduct of Sylvius. Aqueduct of Sylvius. Okay, so this becomes the aqueduct of Sylvius, and that's the fourth ventricle. Fourth ventricle. Is this clear to all of you? Following this? Right, that's the fourth ventricle. So tell me who this is going to form the roof of the fourth ventricle. The roof is formed by the cerebellum, and the floor of the fourth ventricle is formed by the pons and the medulla. The pons and the medulla is going to form the floor of the fourth ventricle. The roof is formed by corpus. The roof is formed by cerebellum. Is this clear? The slide is clear to all of you? Any doubts you have in this? Any doubts? Bolo. Yes, aqueduct of Sylvius is the cavity of midbrain. What is this structure which is pointed? If you can answer this. What is this pointed structure? Yes, what is that pointed structure? Anyone? 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 What is that pointed structure? Pineal nahi bache. Pineal is here. Pineal is this. Look, this is pineal gland. पीछे होता है ये pineal gland. That's pineal gland. This is the mammillary body. Mammillary body. Very good. That's the mammillary body. And here है pineal gland. Behind is the pineal gland. Okay, perfect. Perfect. That's about the medial surface of the brain. Okay. Mammillary body. The phonics ends here. The phonics ends in the mammillary bodies. Very good. Chalo, answer this MCQ. Answer this MCQ. Yes, what is the answer? A 50-year-old man is brought to the emergency department complaining of severe chest pain. His angiogram reveals thrombosis of SVC after the entry of azygous vein. Thrombosis of SVC after the entry of azygous vein. This condition would likely cause a dilatation of which of the following veins? Yes, this is a difficult MCQ. I'll draw this for you. I'll draw this for you. Just have a look. Understand this. I'll draw this. Yep. Now tell me, I'll use a highlighter for you. Okay. Now tell me, what are these two veins coming from the neck? Two veins coming from the neck. Deep veins in the neck. Deep veins in the neck. Come on. You answer this fast. Deep veins in the neck. The deep veins in the neck. What are these veins? These are the internal jugular vein. Internal jugular. What are these veins coming from the upper limb? Upper limb. The subclavian vein. Subclavian. So internal jugular, subclavian. Internal jugular is coming from the cephalic region. Cephalic region. The subclavian is coming from the brachium. So what is this vein which is formed here now? One is coming from the cephalic region, one is coming from the brachium. So this is the brachiocephalic vein. That's the right brachiocephalic, that's the left brachiocephalic. The left is longer. The left is longer, the left joins with the right and forms what? What is this now? SVC. SVC. Okay. So these are the two internal jugular, these are the two subclavian. That's the right brachiocephalic, that's the left brachiocephalic, and that's the SVC. And this is a single unpaired vein. What do you call this single unpaired vein as? This is known as the azygous vein. Azygous. Okay, that's the azygous vein. Understand now. What is this vein which opens into the internal thoracic? What is this vein which opens into the brachiocephalic vein? What is this vein which opens into the brachiocephalic? ये आगे है. This is in front. This is in front. What is this vein? This is the internal thoracic vein. Internal thoracic. ये है internal thoracic vein. That's in front here. The azygous vein is backside. Okay, azygous vein is backside on the right side. So this is the internal thoracic vein, and this internal thoracic vein is formed by joining of two veins. One is the superior epigastric. Superior epigastric, and second one is musculophrenic vein. You know, internal thoracic artery divides into two branches, a superior epigastric and a musculophrenic artery. Similarly, the internal thoracic vein is formed by joining of two veins. One is the superior epigastric and the other one is musculophrenic. Two veins join to form the internal thoracic vein, and the internal thoracic vein drains into brachiocephalic vein. Okay, it drains into brachiocephalic vein. Now, what are these veins which are opening into the internal thoracic vein? What are these veins in front? These are the anterior intercostal spaces, and the veins in front would be the anterior intercostal vein. So what opens into the internal thoracic vein? That's the anterior intercostal veins, and this anterior intercostal veins are going to anastomose with the posterior intercostal veins. And the posterior intercostal veins on the right side, they open into azygous vein. Okay, the posterior intercostal veins on the right side open into azygous vein. Are you understanding this? So I've shown you one anastomosis between the anterior and the posterior intercostal vein. Are you understanding, all of you? This is slightly difficult MCQ. Just understand this once again. What are these two veins? Internal jugular. These are the two subclavian. That's the right brachiocephalic. That's the left brachiocephalic. That's the SBC. That is azygous vein. Azygous. This is the internal thoracic vein which opens into the brachiocephalic vein. Only one thing, I can't make a slide like this. Internal thoracic vein aage hota hai, it's in front. Azygous vein is back side. What opens into the internal thoracic veins are the anterior intercostal veins, and the anterior intercostal veins are going to anastomose with the posterior intercostal veins. On the right side, the posterior intercostal vein drains into azygous vein. Okay, now there's an obstruction. Do not write anything. I'll write this for you. Don't write anything. There's an obstruction to the SVC above, below the opening of azygous vein. The obstruction is here. Where the azygous vein opens into the SVC, below that there's an obstruction. Here, below the opening of azygous. Now, how does the blood flow? Now, understand this. How does the blood flow? Just listen here. Do not write anything. The blood has to go down, right? The blood has to go down. There's an obstruction here, so the blood cannot go down. The blood goes in a reverse direction. It goes in the reverse direction. Here. The blood accumulates into this vein. What's that? The brachiocephalic vein. From the brachiocephalic, suppose if the blood enters the internal thoracic vein, then anterior intercostal, then posterior intercostal, then azygous, SBC. This will not work. This will not work. Why? Because obstruction is below the opening of azygous vein. So blood ऐसे जाके कोई मतलब नहीं है. There's no meaning for the blood going like this. Again, there's an obstruction below this. The blood won't go like this. How would the blood go? The blood enters into the internal thoracic vein, goes straight down. What is this now? That's the superior epigastric vein. Quickly tell me. The superior epigastric vein anastomosis with what? Answer. The superior epigastric vein is going to anastomose with. Come on, my dear children. Answer. Do not write anything. You just answer. I'll write this for you. The superior epigastric vein is going to anastomose with the inferior epigastric vein. Excellent, very good. And the inferior epigastric vein is opening into what? It opens into what? The inferior epigastric vein opens into, yes, opens into, inferior epigastric vein opens into, no. Inferior epigastric vein opens into what? Answer this. External iliac. Inferior epigastric vein opens into external iliac. The external joins with internal to form what? To form common iliacs. The external joins with internal to form common iliacs. Both the common iliacs joins to form the IVC, and the blood goes into the right atrium. The blood goes into the right atrium. Understood? Look here once again. The blood goes in the reverse direction. That's the brachiocephalic. From the brachiocephalic, it enters into the internal thoracic vein. Internal thoracic, say it goes straight down. Superior epigastric vein. Superior epigastric, inferior epigastric, external iliac, common iliac, IVC, and right atrium. Okay, is this clear to all of you? So that's how the blood flows into the right atrium. Now there's one more pathway. Okay. Now see here, the blood goes up. Up. That's the brachiocephalic vein. The blood goes outwards. What's this now? What's that? That's the subclavian vein. Answer now. If that's a subclavian vein, what is this going to be? That's the first strip. If that's the first rib, what is this vein now? What is this vein? That's the axillary vein. Axillary vein. If that's the axillary vein, if you can tell me what is this muscle here? What is this muscle which divides the axillary vein into 3 parts? Answer this. The muscle which divides the axillary vein into 3 parts. Come on, come on, come on. Don't write anything. I'll tell you this. This is a difficult MCQ. The blood goes into the brachiocephalic, subclavian. Subclavian say axillary. Axillary, who divides it into 3 parts? Pectoralis minor. Very good. Pectoralis minor. So what is this part of the axillary vein? One moment. What is this part of the axillary vein? First part, that's the second part, and that's the third part of the axillary vein. In the second part of the axillary vein opens a vein here. Can you tell me this? What are the branches of second part of axillary artery? Come on, tell me. What are the branches of second part of axillary artery? If you know that, you understand the second part of axillary vein. What are the branches of second part of axillary artery? One is the... Bolo. Answer. What are the branches of second part of axillary artery? One is the lateral thoracic, and the second one is the thoracoacromial. Lateral thoracic and thoracoacromial artery. So yes, very good. So what is this vein? This is the lateral thoracic vein. Okay, lateral thoracic vein. And this lateral thoracic vein of the upper limb, okay, this lateral thoracic vein of upper limb is directly communicating with the vein of the lower limb. It communicates with the vein of the lower limb. What is this vein? This is the superficial epigastric vein. Superficial epigastric vein. Tell me quickly, the superficial epigastric artery is a branch of what? If you remember this, superficial epigastric artery is a branch of... Yes, come on. Superficial epigastric artery is a branch of what? This is a big MCQ, different veins, anastomosing right from the upper limb to the lower limb with the help of connecting veins. Superficial epigastric artery, very good. It's a branch of femoral artery. So superficial epigastric vein would drain into what? What do you say? Superficial epigastric artery is a branch of femoral. Agreed. So superficial epigastric vein drains into what? Femoral vein? Is this what you're saying? No. It doesn't drain into femoral vein. It drains into the great saphenous vein. Great saphenous vein. The great saphenous vein then drains into what? Femoral vein. Femoral continues as external iliac. Then common iliacs, IVC, right atrium. Yes, IVC and right atrium. So that's how it is. So look here, when there's an obstruction to the SVC below the opening of azygous vein, the major pathway of blood flow is like this. That's the brachiocephalic, that's the subclavian, that's the axillary, that's the lateral thoracic vein, and then this vein. I'll tell you this. To the superficial epigastric to the great saphenous, femoral, external iliac, common iliac, IVC, and the right atrium. Now, you're sitting in your clinic, right? And a person comes to you, and you examine the lateral aspect of the chest wall, and you find a dilated and tortuous vein here on the lateral side of the chest wall. You find a dilated and tortuous vein, and this dilated and tortuous vein is going to connect two veins, a vein of the upper limb with a vein of the lower limb. Which vein of upper limb is that? Lateral thoracic. But which vein of the lower limb is that? The superficial epigastric. The lateral thoracic to the superficial epigastric. If you join this two, sorry, oh my god, that's gone. If you join this two, that slide is gone. You get the name of the vein. The vein which connects the lateral thoracic vein to the superficial epigastric vein, and this is the thoracoepigastric vein. Okay, so that's the thoracoepigastric vein. Is this clear to all of you? That's the thoracoepigastric. The answer for this would be the thoracoepigastric vein. I'll write this for you. Thoracoepigastric vein. Okay, I'll write that, and then if you want, I'll draw the slide for you. You know, once a picture is gone, it doesn't come back. So I'll just write this for you. Obstruction to the SVC below the opening of azygos. Below the opening of azygos vein. Obstruction to the SVC below the opening of azygos. There are two pathways. One, I'll start it like this. Brachiocephalic vein, subclavian, brachiocephalic subclavian, axillary, lateral thoracic, thoraco-epigastric, superficial epigastric, great saphenous, femoral, external iliac, common iliac, IBC, right atrium. I'll tell you. So obstruction to the SVC below the opening of azygos vein. The blood flows to the brachiocephalic, then it goes outward, subclavian, axillary, lateral thoracic, then the thoraco-epigastric vein, thoraco-epigastric, superficial epigastric, great saphenous, femoral, extrailiac, common iliac, IVC, and the right atrium. Now, which is the other pathway? There's one more pathway. Okay, there's one more pathway. Understand this now. The blood goes from the brachiocephalic, the blood goes to the internal thoracic vein. Internal thoracic, superior epigastric, inferior epigastric, external iliac, common iliac, IVC, and right atrium. Yes, clear to all of you? What happened, Junish? Yes. Janish, clear enough? So this is obstruction to the SVC above the opening of azygos, below the opening of azygos vein. I'm so sorry. Below the opening of azygos vein. Is this clear to all of you? Koi doubts hai? Any doubts? So a person comes to you and you find a dilated and tortuous vein on the lateral aspect of the chest wall. It connects two veins. One is the vein of the upper limb with the vein of lower limb. Which vein of upper limb is that? The lateral thoracic vein with the vein of lower limb. That's the superficial epigastric vein. And the name of this vein is thoraco-epigastric vein. Thoraco-epigastric. Clear to all of you? Now, if there's an obstruction to the SVC above the opening of azygos, I'll just write it down. Done with this, all of you? So then I'll tell you the obstruction above the opening of azygos vein. Yes, Janish, you remember this is what I used to tell there also. Yes, but this MCQ is very important. Okay, obstruction to the SVC above the opening and below the opening of azygos vein. Okay, fine. I'll just draw this for you once again. That's the internal jugular once again. Internal jugular vein. That's a subclavian vein. Subclavian, internal jugular, subclavian. The right brachiocephalic, the left brachiocephalic. The left is longer. Why it's longer, that we'll discuss later in some other MCQ. That's a SVC, and this is a single unpaired azygous vein. That's a single unpaired azygous vein. Okay, and now what is this vein? What is this vein which opens into the brachiocephalic vein? That's the internal thoracic vein. Internal thoracic vein opens into brachiocephalic. If that's the internal thoracic, what's this and what's this? This is the superior epigastric, that's the musculophrenic. If that's the internal thoracic vein, what is this vein? I'm just drawing one vein for you. That's the anterior intercostal vein. And this anterior intercostal vein is going to anastomose with the posterior intercostal vein. The posterior intercostal vein opens into what? On the right side it opens into azygous vein, on the left side it opens into hemiazygous and the accessory hemiazygous. This you know. Yes, longer because it is contributed by anastomosis, bache. It is not common cardinal, it is anastomosis between the two anterior cardinal veins. That we'll discuss later. Now see, now there's an obstruction to the SVC above the opening. I told you below the opening of azygous vein. Now I'm telling you the obstruction above the opening of azygous. Dekho, that's the obstruction. Obstruction is above the opening of azygous. How does the blood flow now? Just now I told you obstruction below the opening of azygous vein, right? Now tell me, the obstruction is here. The blood cannot go down. The blood accumulates here into the brachiocephalic vein. The blood enters into this vein. What is this vein? Internal thoracic vein. From the internal thoracic there are two pathways. Two pathways here. One is this anterior intercostal vein, posterior intercostal vein, azygous, SVC, right atrium. SVC and right atrium. Okay, so one is internal thoracic vein, anterior intercostal, posterior intercostal, azygous, SVC and right atrium. That is one way. The second pathway is the same. Internal thoracic vein goes straight down. Superior epigastric, inferior epigastric, extrailiac, common iliac, IVC, right atrium. In this case, there's no thoracoepigastric. Thoracoepigastric is when the obstruction is below the opening of azygous vein. Aman, ठीक है ना? When the obstruction is below the opening of azygous, then thoracoepigastric आता है. I'll just write this for you. Look. Obstruction to the SVC above the opening of azygous vein. Above azygous vein. So there are the blood goes into internal thoracic vein. Internal thoracic vein. Now there are two pathways. Anterior intercostal vein, posterior intercostal vein, azygous, SVC, right atrium. Go to the other side. What would this be? Internal thoracic vein, superior epigastric, inferior epigastric, external iliac, common iliac, IVC, right atrium. So this is obstruction above the opening of azygous vein, and if you want, I'll draw the obstruction below the opening of azygous vein also for you. That's the first strip. Yeah, I'll just complete this. That slide is gone actually, because here the slides are not retained. Yeah, yeah. ये pectoralis minor हो गया. ठीक है. So I've told you both the obstructions हैं बच्चों. First part, second part, third part. Second part में that's the lateral thoracic. Okay, and this lateral thoracic vein of the upper limb communicates with the vein of lower limb. What is this vein? ये होगा thoracoepigastric vein. Thoracoepigastric. This is the superficial Epigastric. Yeah, no, superficial epigastric is a different vein. Superior epigastric is a different vein. Don't get confused between two. Superficial epigastric vein is a branch of, it drains into great saphenous. Superficial epigastric drains into great saphenous, whereas the superior epigastric vein is a tributary of internal thoracic. Superior epigastric. Okay. Perfect. 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 Clear to all of you? Perfect. Koi doubt? Understood, all of you? So this is a very important MCQ, and I have explained you everything. I've drawn both the obstructions. ये दोनों obstruction मैंने draw किया है above the opening of azygous vein and below the opening of azygous vein. When you are studying above, remove the obstruction below the opening of azygous and vice versa. ठीक है? Fine. So that's about the MCQ. I'll clear this. I'll clear this because I can't put the slide again. It goes off. It is not saved. Right. Very good. Coming to this. So ये clear है? Tell me now, how is the hemiazygous vein formed? Hemiazygous vein, how is it formed? Hemiazygous vein is formed by the joining of Bolo, come on. Hemiazygous and accessory hemiazygous. Accessory hemizygous is formed by 5, 6, 7, 8. 5, 6, 7, 8 left posterior intercostal veins joins to form the accessory hemiazygous. 9, 10, 11 and 12 joins to form the hemiazygous vein. Hemiazygous. Okay. What is left superior intercostal vein? How is it formed? Left superior intercostal vein is formed by the joining of left, second, third and fourth posterior intercostal vein. Left, second, third and fourth posterior intercostal vein joins to form the left superior intercostal vein. And the left superior intercostal vein drains into what? Come on, answer this, all of you. The left superior intercostal vein drains into. Answer. The left superior intercostal vein drains into left brachiocephalic. Left brachiocephalic, right? The left superior intercostal vein drains into the left brachiocephalic. The right superior intercostal vein is formed by the joining of second, third and fourth right posterior intercostal veins, and the right superior intercostal vein drains into azygous vein. Right superior intercostal drains into azygous. Okay. Fine. Okay, before I go to the next MCQ, just a brief about our platform, Unacademy platform. We've got this plus subscription in which you have got daily live classes, the live quizzes, the structured courses and unlimited access to the course material. We've got an iconic subscription where you've got the best of Unacademy, the lectures and the pre-planner notes. The prices are further slashed. This is a limited time offer. Just have a look at the website. Now we've started a 4-year subscription course for the foundation students. A new technique which has been introduced in the app. Raise the hand. There's a small icon at the corner. Okay, if you press that, you can directly talk to the educator. Right now, with 3-month subscription, we get 1 month free, and 12-month subscription, you get 2 months free. And download the Unacademy app. Okay, fine. Right. So now coming to this, just one last MCQ I'll be able to tell you. So I've started with this series, MCQ and image based revision. Thursday, Friday, Saturday, Sunday, 4 days in a week. Thursday, Friday, Saturday, Sunday till your ini-cet. Okay, identify this pointed structure. Digastric bache, just see the slide properly. Akanksha, see the picture properly. It's a dissected specimen. You always want dissected specimens, right? So I put this dissected specimen for you. That's not digastric, my child. Yes, this is the omohyoid. Ankit, omohyoid doesn't have an anterior belly, my child. Anterior and posterior belly is for the digastric muscles, right? Digastric का होता है anterior and posterior belly. What is it for the omohyoid? What is that? Omohyoid also has got two bellies. Name? Not anterior. Anterior belly of omohyoid नहीं होता है. That's the superior belly and the inferior belly of omohyoid. Superior and inferior belly होती है omohyoid के. Anterior and posterior belly are of digastric muscles. Digastric, right? So what is this which is pointed here? That's the superior belly of omohyoid. Superior belly of omohyoid. And what would this be? This would be the inferior belly of omohyoid. Inferior belly of omohyoid. If that's the superior belly of omohyoid, what is this muscle? Which is the muscle next to the superior belly? In the same plane they lie. They lie in the same plane. But if this is the superior belly of omohyoid, and what is this muscle? They lie in the same plane. If you can answer that. The one which I've pointed. Again I'm pointing this muscle. Yes, what's this muscle? Come on, come on, come on, come on. Guess this. Guess. Sternohyoid. Sternohyoid. Yes, that's sternohyoid. Very good. Sternohyoid. So two muscles lie in the same plane. One is the superior belly of omohyoid and the sternohyoid. If I remove the sternohyoid, okay, I remove the sternohyoid, I find two muscles below the sternohyoid. One is the sternothyroid and the second one is the thyrohyoid. Sternothyroid and thyrohyoid, they lie below this sternohyoid. Are you following this? Clear? So which are the muscles below it? So two muscles in the same plane, superior belly of omohyoid and sternohyoid. We remove the sternohyoid and the omohyoid, you find two muscles deep to them, sternothyroid and the thyrohyoid. These are the strap muscles. Very good. What is the nerve supply of all these muscles? Answer. That's a muscular triangle. Very good. What is the nerve supply of all these muscles? Nerve supply, nerve supply, nerve supply. Nerve supply, ansa cervicalis. Very good, ansa cervicalis. So all the strap muscles are supplied by ansa cervicalis except, yes, tell me, except one strap muscle which is not supplied by ansa. Who's that? Except. All the strap muscles are supplied by ansa cervicalis except thyrohyoid. Very good. Thyrohyoid is supplied by C1. Fibers of C1 supply the thyrohyoid muscle. C1. Just remember this is C1. Direct C1. 12th nerve nahi hai. These are the fibers of C1. They are going with the hypoglossal nerve. Hypoglossal nerve has got nothing to do to supply the thyroid. These are the fibers of C1. They go with the hypoglossal nerve. Okay. So who supplies the thyroid? C1 fibers. C1 fibers. Any other muscle supplied by C1 other than thyroid? Any other muscle supplied by C1? Answer. Any other muscle supplied by C1? That's the geniohyoid. Okay, geniohyoid and thyroid are supplied by C1. Okay, very good. Right. If you can guess what is this muscle, ये क्या हो सकता है? What could this muscle be? You can just guess this. What is this muscle? Yes, very nice. Akanksha, very good. That's pectoralis minor. Very good. That's pectoralis minor. Excellent to all of you. So, what is this bone? You can see a bone here. What is that bone? Bone to which the pectoralis minor is attached to. the bone to which the pectoralis minor is attached to, that's the coracoid process of scapula. Coracoid process of scapula, and this is the brachial plexus and the axillary artery. This is the axillary artery and this is the brachial plexus. They're going behind the pectoralis minor. They're going behind the pectoralis minor, and that's how the pectoralis minor divides the axillary artery into 3 parts. Okay, this is the first part. Behind the muscle would be the second part, and after the muscle would be the third part of the axillary artery. Okay, so I was able to tell you only this much today. This is fine. So but you have understood a very important MCQ about the thoraco-epigastric vein, right? And I've shown you 2 visual slides. So again, tomorrow I'll continue with the same series at 9 o'clock. Okay, some image-based questions and some MCQs for you. A mixed bag. I hope you are understanding everything. Okay. Fine, slowly the topics which you have told me, that also I'll try to incorporate in the form of an MCQ or a clinical based question. Right? Thank you to all of you. Thank you. See you again tomorrow. Thank you. We'll meet tomorrow once again.